There are 5 health examinations that you should steer clear of after the age of 70 because they could cause you more harm than good. There is a secret that the majority of middle-aged and elderly people will never learn from their physicians. In the belief that they are protecting themselves, millions of elderly people wait in line for health examinations each year. That's not nothing, but it's not even close to being saved from death. As a matter of fact, those ladies had a significantly higher risk of experiencing adverse reactions to the medications they were taking, which included digestive problems, inflammation in the esophagus, and brittle bones that broke in peculiar ways. I would like to tell you about Rose, a retired piano teacher who is 76 years old. Following her annual checkup, she was recommended to undergo a DEXA scan. Every day she walked, and she had never had any pain or a fall. She was diagnosed with osteopenia, which is a minor decline in bone density, but is not believed to be osteoporosis. Her scan revealed this condition. It was immediately prescribed by her physician that she begin taking alendronate, which is a bisphosphonate. She began experiencing significant jaw discomfort and reflux after 3 months of being there. It had been some weeks since she had played the piano by the time we visited her. Following the discontinuation of her medication, we began a regimen consisting of vitamin D, weight-bearing activities such as resistance bands, and a diet that was high in calcium and included foods such as sardines and leafy greens. It was a year later when she resumed her recital performances, this time with legs that were stronger, her balance improved, and she had no fractures. Even while a quick scan can appear to be a good idea, the preferable choice for persons over the age of 70 who are not in danger of breaking bones or falling is to focus on their lifestyle. According to a study that was conducted by Osteoporosis International in 2022, the reduction of fractures by more than 20% can be achieved by the utilization of strength training, balance exercises, good diet, and the treatment of vitamin D insufficiency. Do not let the sight of a number on a screen influence you to seek treatment that you might not require. There is, however, one scan that has the potential to lead to something even more terrifying: brain surgery. Following that, let's talk about that. The brain MRI for memory loss comes in at number 4. Fear is a natural response that occurs when elderly people experience increased forgetfulness or confusion. There is a fear of Alzheimer's disease and dementia. Therefore, the typical response from medical professionals is to request an MRI of the brain. On the other hand, here is the unsettling reality. The answers that patients are seeking for are rarely provided by magnetic resonance imaging, MRI scans, which are detailed images that show the structure of the brain. In point of fact, the majority of magnetic resonance imaging, MRI, scans performed on individuals aged 70 and older simply reveal age-related changes. These changes include a minor reduction in brain volume or the presence of white matter spots, both of which are quite typical in older persons. But this is when things become really interesting. Following the discovery of those spots, a chain reaction of dread, additional tests, and possibly surgical intervention may ensue. There is a possibility that surgery will not enhance memory and may even make the situation worse. Neurology. Today released a study in 2021 that examined more than 3,000 magnetic resonance imaging, MRI images of patients aged 70 to 85 who had minor cognitive symptoms. Percent of the samples showed some kind of abnormality in the brain, but only 3% of those results were associated with a disorder that could be treated. It is estimated that 97% of individuals have experienced the emotional toll of hearing that there is something wrong when in reality there was nothing wrong. Worse, nearly 12% of patients were referred for invasive treatments such as spinal taps or even exploratory biopsies, all of which were based on scan results that were not clear. Consider the case of George, a retired engineer who is 74 years old and presented with concerns regarding forgetfulness. He was a clever individual, yet he frequently misplaced his keys and occasionally forgot people's names. He was referred to an MRI by his physician, which revealed alterations in the white matter. In a state of fear, he was certain that he was suffering from dementia. Both his driving and his attendance at church came to an end. The subsequent few months brought about a worsening of his uneasiness. On the other hand, what if I told you that some of those tests, the ones that your doctor considers to be ordinary, could potentially bring you closer to the possibility of having surgery, having a stroke, or even having cancer? According to recent research, as many as 37% of medical examinations performed on elderly patients result in unneeded treatments, problems, or side effects that last a lifetime. The results of the reassessment that we performed on him using a conventional cognitive test revealed that his score was well within the normal range. We indicated that the findings of the MRI were appropriate for the patient's age. We guided him toward lifestyle changes such as getting enough sleep, being hydrated, and playing cognitive games. Within 3 months, his memory had returned to normal, and he experienced a sense of being himself once more. When it comes to minor memory loss, an MRI is not typically beneficial unless there are serious neurological symptoms accompanying the condition, such as seizures, unexpected personality changes, or quick declines in functional abilities. A cognitive screening test, which is a straightforward examination that is conducted on paper and examines memory, attention, and problem-solving skills, is a more appropriate initial step. It is inexpensive, efficient, and prevents the chance of any unneeded panic from occurring. Now you should brace yourself because the following test on our list is one that you have most likely taken more than once, and there is a good reason why it is the third test on this list. The heart stress test comes in at number 3. One of the most popular tests that is administered to elderly people who are complaining of minor weariness, chest tightness, or simply not feeling as they used to is the chest constriction test. The cardiac stress test is a process that measures your heart while you are walking on a treadmill or being given medication that simulates activity. The purpose of this test is to identify clogged arteries. However, after the age of 70, this test frequently causes more harm than benefit, particularly when it is administered to individuals who do not exhibit any obvious symptoms of cardiac disease. This is due to the fact that it sometimes results in false alarms and unneeded heart treatments, both of which pose significant dangers. The issue is in terms of the precision. Studies have shown that the percentage of false positives for stress tests, which means that the test indicates that there is an issue when there actually isn't, can reach as high as 40% in persons over the age of 70. When this occurs, subsequent tests such as angiograms are performed, and even needless stent implantation or bypass surgery may be performed. A significant study that was published in the journal JAMA Cardiology in 2017 discovered that more than half of all stents that were implanted following stress test recommendations were performed on patients who did not have any genuine symptoms or benefits, and those patients did not see any increase in their quality of life or survival rate as a result of the treatment. On the other hand, they did experience increased rates of bleeding, kidney damage as a result of contrast dyes, and extended hospital admissions. Raymond, a retired postman who was 75 years old and kept himself active by walking every day, experienced this happening to him. He noted that he occasionally experienced fatigue when climbing hills during a checkup. A stress test was ordered for him by his physician just to be sure. He was sent for a catheterization, which is a test that involves inserting a tube into the arteries in order to look for blockages. The results were ambiguous, so he was sent for the procedure. When we get started, I would really appreciate it if you could tell me where you are coming from today. Leave a remark below, and if you have any questions, please don't hesitate to ask them. In addition, make sure you click the subscribe button and enable notifications so that you are never left out of Senior Health Tips' most helpful health advice. And if you are watching at this very now, I want to know that you are agreeing with me. Leave a comment with a 1 if you feel that this video resonates with you. In the event that not type 0, following the discovery of a little constriction, a stent was inserted. To add insult to injury, 99% of persons over the age of 70 are unaware that they are being over-tested. It is estimated that one of these checkups, which is the first on our list, is responsible for 5% of all cancer cases in the United States. This is equivalent to the number of instances that are caused by drinking alcohol on a daily basis. This is not something that your clinic will tell you. You will not find it displayed on a billboard. On that particular evening, however, Raymond experienced a response to the contrast dye, which resulted in kidney difficulties. His stay in the hospital lasted for 6 days, and he required follow-up care for several weeks. Due to the fact that it was not a cardiac condition until the very beginning, the fatigue never changed. The fact of the matter was that he was an elderly guy who needed more rest in between meals and improved hydration. If you are above the age of 70 and you are not experiencing conventional cardiac symptoms, such as chest pain during activity, shortness of breath when exerting yourself, or a major reduction in energy with light exercise, then a stress test may be more detrimental than beneficial. A resting electrocardiogram, which is a test that examines the rhythm of the heart when the patient is in a state of rest, or even a coronary calcium scan, which is a low radiation imaging test that determines whether or not harmful plaque is beginning to accumulate, is typically a more suitable alternative. These are safer, easier, and offer a significantly lower risk of forcing you to have a procedure that you did not require. In second place, the colonoscopy. It is highly unlikely that you anticipated this one. With that being said, colonoscopy, which is a technique that involves the use of a long camera to check your colon, is not always a prudent decision after the age of 70, and it is practically never suggested after the age of 75 unless there are certain symptoms. As one gets older, the dangers become more severe. In addition to being abrasive, the preparation contains powerful laxatives, which can lead to symptoms such as dehydration, disorientation, or kidney problems. In older persons, the anesthesia that is used during the treatment poses additional dangers to the functioning of the brain. The test itself can produce issues such as bleeding, tearing, or even changes in the heart rhythm while the patient is under sedation. This is possibly the most startling aspect of the test. JAMA Internal Medicine published a research in 2019 that monitored more than 1.3 million Medicare participants who were 70 years of age or older. Based on their findings, they discovered that just 2 lives were saved for every 1,000 colonoscopies performed on individuals aged 75 and older, while over 20 people faced major problems. This is a risk-to-benefit ratio of 10 to 1, and even when polyps are discovered, the majority of them are quite small and grow very slowly. When it comes to caring for an elderly person, removing them might sometimes cause more harm than leaving them alone. With her daughter Dana, who was 73 years old at the time, managed a modest bakery they owned together. There were no signs or symptoms, no bleeding, no changes in her stool, and there was no history of colon cancer in her family. But her new primary care physician, who had just finished his residency, strongly recommended that she obtain a screening colonoscopy. She was in agreement. A little polyp was removed from her during the treatment, and she was then discharged to go home. That night she was experiencing severe agony in her abdomen region, and she passed out. When they arrived at the hospital, they discovered a perforation in the bowel. In the 9 days that she spent recuperating, she shed 10 pounds, and ever since then, she has not been the same. During the course of our investigation, we discovered that she had previously undergone 2 colonoscopies that were both successful. There was no justification for doing it again. For the majority of adults, the United States Preventive Services Task Force currently advises that routine colon cancer screening be discontinued at the age of 75. Tests that are based on stool, such as the FETI test, which is a non-invasive fecal test that can be performed at home, are frequently the safest alternative for individuals who are in excellent health. Even if it does not require any preparation or sedation, it is nevertheless able to identify the majority of worrisome instances. If you are already in the process of getting a colonoscopy, it is difficult to get out of it. That is why you should ask your doctor about other options. However, the truth is concealed within the scientific community, and today we are excavating all of it. The 5 health exams that you should avoid getting after the age of 70 are discussed in this video, along with the terrible truth about what these checkups can do to your body. All of this is supported by actual scientific research, and you won't believe what made it to the second spot. And now we have arrived at the most overused, most risky, and most destructive checkup for elderly citizens, and it is almost guaranteed that you have previously undergone this examination. First and foremost, complete body CT scans per year. The use of full-body computed tomography, CT scans, which are occasionally included in executive health packages or provided as preventive services in private clinics, is promoted as a method for detecting cancer at an earlier stage. Nevertheless, here is the terrible reality. Your body will be subjected to a significant amount of ionizing radiation during these tests. The likelihood of causing unneeded follow-ups, biopsies, and even surgical procedures is extremely significant for older persons. particularly those who are above the age of 70. The irony is that there is not a single piece of evidence to suggest that full-body scans that do not involve symptoms save lives. Approximately 500 chest X-rays are equivalent to the amount of radiation that is delivered by each scan, which ranges from 10 to 20 millisieverts. A modeling study that was published in the year 2023 in the journal JAMA Internal Medicine suggests that the increase in the number of CT scans performed in the United States may now be responsible for as much as 5% of all malignancies. This would put CT scans on par with alcohol as a factor that causes cancer. This indicates that a scan that was intended to prevent disease could be responsible for the development of one cancer out of every 20 cases. This is not only counterproductive, but it is also extremely frightening. It is possible for the scan to identify benign nodules, calcifications, or cysts that are a natural part of the aging process. Nevertheless, the instant they are discovered, a warning sign is raised. After that, there are further scans, then biopsies, and finally, fear. Please allow me to tell you about Marcus, an active senior citizen who is 80 years old and used to instruct younger seniors in martial arts. He went to a private clinic for a senior elite checkup and reported that he was feeling terrific afterwards. His full body scan revealed a very little lump that measured 3 millimeters in length. That triggered a domino effect of events. After receiving a referral to oncology, he was then sent for a PET scan and ultimately had a needle biopsy process. What is the end result? Unharmful. However, the biopsy caused a portion of his lung to collapse, which resulted in him being hospitalized and requiring a rehabilitation period of 2 months. All of this for something that it would have been possible to ignore. Full-body computed tomography scans should never be used for general screening in persons who are asymptomatic, according to the recommendations of experts. Evidently, the American College of Radiology is unambiguous. There has been no evidence of any benefits, and there is a considerable risk of injury. The use of targeted imaging makes sense in the event that there are symptoms, such as a loss of weight that cannot be explained, coughing up blood, or apparent edema. However, scanning the entire body without focusing on any particular area is analogous to using a landmine detector to look for treasure. Despite the fact that you might discover something, the damage might be even more severe than what you were attempting to avoid. Paying attention to what your body is telling you is a more prudent option. You should go to your primary care physician for examinations on a regular basis if you are feeling well, and you should only undergo tests that are clearly suggested. It would be a waste of your time, energy, and health to waste them on screenings that are motivated by fear and could leave you in a worse medical condition than you were in before. You now get the full picture. There are 5 exams that may appear to be beneficial, but they can actually be harmful, particularly after the age of 70. Modern medicine is extremely effective, yet it is not without its flaws. There are times when little is more. Always make sure to ask, what can we expect next if this test turns up something? It is possible that it is appropriate to take a break if the answer is not clear or if the dangers are greater than the potential rewards. Remember that the first step in true prevention is changing your lifestyle. Always make sure to stay active, eat healthily, get plenty of rest, and select your checks carefully. Before we get started, in the comments section below, please let us know where you are watching from, how old you are, and whether or not you have ever regretted undergoing a test or operation. Do you believe that test taking for seniors is excessive? Not only are we reading and responding to each and every comment with individualized recommendations and suggestions, but you should also make sure to like this video and subscribe to our channel so that you may watch future films just like this one. When we get started, I would really appreciate it if you could tell me where you are coming from today. Leave a remark below, and if you have any questions, please don't hesitate to ask them. In addition, make sure you click the subscribe button and enable notifications so that you are never left out of senior health tips, most helpful health advice. And if you are watching at this very now, I want to know that you are agreeing with me. Leave a comment with a 1 if you feel that this video resonates with you. In the event that not, type 0. We are now interested in hearing from you. Have you or someone you care about ever experienced negative consequences as a result of a medical examination or treatment that turned out to be unnecessary? So, what took place? Write down your thoughts and experiences in the comments section below and share them with us. It brings us great joy to listen to them. We appreciate you watching. Immediately, without further ado, let's talk about the first test that we have to take. Why, despite its apparent lack of danger, it has the potential to subtly diminish the quality of your life. Bone density scan comes in at number 5. It seems innocent enough. It is a short scan, there is no pain, and there are no needles involved, and you will leave knowing whether or not your bones are at danger for fractures. But here's something that nobody tells you. After the age of 70, a bone density scan is likely to cause more anxiety than it does to provide any benefits. This scan, which is referred to as a DEXA scan in the medical field, is used to determine the strength of your bones. Although its primary purpose is to identify osteoporosis, the results almost always come back showing reduced density in older persons, particularly women. This is the case even when there is no actual risk of developing osteoporosis. Because bone loss is a natural component of the aging process, this is the case. This is something that everyone experiences, much like wrinkles or gray hair. Despite this, a significant number of elderly people are coerced into taking pharmaceuticals such as bisphosphonates, which are intended to strengthen bones but come with terrible side effects such as jaw necrosis, which is a very uncommon condition in which the jawbone begins to die, and esophageal irritation. Now let's talk about the issue. According to a number of studies, the use of medicine to treat minor bone loss in individuals over the age of 70 has a minimal to non-existent effect on the actual fracture rates. After 5 years, the researchers discovered that bisphosphonates reduced the incidence of fractures by only 0.3%, according to a study that was published in the Journal of the American Geriatric Society. The study tracked over 2,200 women who were over the age of 70.